Great. So I think it's 1 on the dot, more or less, and I'm hoping all the projects are here today. So I think we can make a start. Good afternoon, everybody. My name is Ginevra Papi, and I work as a communication officer at the Association of European Cancer Leagues, and we are a very proud partner of the CBIG-SCREEN project, which is one of the projects, of course, present today. And my colleague Vanessa will be giving a presentation about the project later on. But before I pass the floor to Professor Marc Bardou, who is the project coordinator of our project, I would like just to welcome you all to this second so-called meet and greet, which is actually part of a series of meet and greets that we are planning on organizing throughout the duration of all our projects. So we are focusing on the 6 projects that are funded under the GACD call of the Horizon 2020 program. And basically, we thought that it would be good to have this kind of cluster meetings to exchange information, to liaise with each other, avoid duplication, and really identify the synergies between our projects. So we had the first meeting back in January, which was kind of the first time where we all met and got to know each other. And it was mostly project coordinators kind of giving an overview of all the projects in general. And this time we thought that in the framework of European Week Against Cancer, which takes place every year from the 25th to the 31st, so we kind of want to mark the day in some way, we thought of bringing together really the people who are working on the communication, dissemination, and exploitation activities. And just a few housekeeping items from my side before I pass it to Marc. And of course, I know most of you are very much familiar with Zoom and the netiquette, but just to remind you, this is quite an informal meeting, so please do keep your camera on if you wish. Actually, I think it's quite nice for presenters to feel that they're presenting to somebody, even if it's just virtually. And we really want you to ask questions during the Q&A sessions, and Marc will say a few words more about the objectives of the meeting and the agenda later on, but please feel free to ask any questions. And don't worry too much about taking detailed notes. We are recording the webinar. We'll be sharing all the presentation afterwards. So yeah, just sit back, relax, and enjoy the presentations. And I'll give the floor to Marc. Thanks from our side, ITCL.
Thank you, Ginevra. So I'm not going to be long. So as Ginevra has mentioned, this is our second meeting, and I would like really to warmly thank Ginevra and David and the ESL for organizing this meeting. And clearly, it is essential that as we have all been funded by the EU to work on the same disease that we share our program, we share our dissemination activity, because as we know, building results means nothing if we do not disseminate the results. So we have in mind to have regular meeting during the life of our project to share as much as we can during the project, because I think that we may build together all the elements that we can build to once again try to meet the WHO goal of eradicating cervical cancer. I'm not going to be much longer. I think now it's the time for Yonis to say a few words. Am I correct?
Is it for me? Hi, Marc. If I heard you correctly, right, Ginevra? Okay, very nice to join you, and very pleased to see that you keep the momentum. You keep the second edition of these meetings, and I have the same pleasure to be with you to remind that I find it so important that you bring a critical mass when you synergize together 6 Horizon 2020 funded projects. And it's something that we can only welcome, representing my service and the Commission services on the whole. Please you let me know. I have also prepared some slides that I have checked with Gina. Is it now the right moment to move on? Okay.
Yes, please. Thank you.
So I think it's more or less 5 minutes or maybe a bit more. Allow me to share my screen here. So please let me know if you are able to see the screen.
coming up.
Is it the case?
Yes, it's in presentation mode, kind of like we see both the presentation and the following slides, but I think it's okay.
Let me know. Okay, so then shall I continue like that? I have put some slides together that some they include a bit of repetition, but in an updated visual format. I have talked about the agency, the Health and Digital Executive Agency, the last time I joined you, and here I would like to present also the vision that our agency has, responsible for the management of your 6 projects. So it is the agency's vision to boost Europe by building from Earth to space, a healthy society, a digital economy, and a competitive industry. And with that, I would like to pinpoint to the different program sectors that our agency is dealing. Health, it comes first, as you can see, it's an important part of the agency's activities, but also we deal with food safety, space, industry, and the digital sector. And since you have heard here, you have also allowed me to walk you through quickly the different dedicated budgets that this visual helps to see with orange, that for the future, for the period covering 21 to 27, we have an important task to do. We have the Horizon Europe, that means the predecessor of the Horizon 2020 and Societal Challenge 1. Now we have the Cluster 1 here, and the Cancer Mission. And next to it in yellow, you can see the EU for Health, that also takes activities from the Europe's Beating Cancer Plan. And of course, I'm highlighting these activities because it's important, I think, to your fields of interest and the research lines you follow. I move on with again an updated slide on the distinct roles and the responsibilities. I had a nice discussion with Ginevra, and I think we'll keep changing the Commission services, and I will try to be your reference point, contact person, so you don't lose track. So we have now, as you can see, European Commission on the left with different departments, policy DGs. Maybe the most interesting for you, it is the DG Research and Innovation, called RTD in Brussels language, and also the DG Health and Food Safety, called SANTE. RTD is dealing with the Cancer Mission, when we specifically discuss about cancer, and SANTE is dealing with the Europe's Beating Cancer Plan. Another DG that it's not connected directly to HADEA, but it's interesting for you, is the Joint Research Center, the JRC, as they have recently launched also the Knowledge Counseling Center. And I will be always happy as we proceed in the coming months and years to exchange information. So the DGs are defining policy. There are departments responsible for policy in the Commission, whereas HADEA, as I have mentioned also the last time, we're responsible to implement with you from the evaluation up the entire life cycle of the project to be together and implement the actions. At the same time, it's important that we provide back to the policy DGs important feedback for policy making for what is coming next. And then I rely on the great cooperation we have to make it the most effective possible. I move on, as I discussed with Ginevra, because I think for all you active researchers, it's interesting to know what is in the pipeline. You have secured your funding for these 6 projects, but I'm sure you're very interested to know our new calls. And here you can see the slide. We have also the opening of the next Cancer Mission topics, and you can have the links of the recent Info Days event on Cancer Mission. You can find the information slides and recording, as also Ginevra knows very well. And please feel free to read it, to listen for yourselves, and spread it with your networks. This information, I'm sorry, I go now to the right direction that outline you. I hope I have, Geneva, otherwise you let me know, 4 minutes to outline you quickly. I will only walk through some platforms and tools that I find it very interesting as the scientific project officer advisor for you. Maybe you don't have them all together, and it's going to be a good idea to have all together platforms and tools and what is it, the value of each of it, so you can make the most out of them. Here in this slide, you can see the Horizon 2020 online manual. I'm sure the dedicated project management teams and the communication teams, they know very well. It's your reference, let's say, online manual for how to manage the projects. In this page, you can see I have chosen, because of the focus of the event today, to give the communication of your project that comes together with the tab of the dissemination exploitation and the tab on the appropriate acknowledgement of the EU funding. I think you may please make it one of your favorites on your browser, so you can go and check the information that you need each time. At the same time, the European Commission services, they have the CORDIS database on gathering each project receiving funding, like in your case, I just put now as an example the CBIG-SCREEN project, that you have the kind of ID. You find always your budget, your timeline, your title, your abstract. But what has been a novelty in the last years, and it's important to emphasize, I have already done, but now you see it also visually, it is that you have the extra tab of results and more tabs that the service is getting populated over the time. And here you will find in due course, right now for the 6th project, it's still in the beginning phase, but in due course, all deliverables that they have been flagged with dissemination status public, they will be automatically, after the approval by me, in this case, by the scientific officer, they will be automatically published here. And my key point, if you allow me, is to be careful of what it's published, the quality, and again to think the synergies, what it can bring added value on top of what it has been described in the proposal. I repeat my key message: whatever activity brings added EU added value, it will be always most welcome. I continue to the Horizon dashboard. It's another public view platform that you have access. It's called Horizon Dashboard. You have the link here, and you can go and play. Let's put it like that. In my case, I just played with a GACD call. So you can generate maps, you can generate figures that you might find helpful. It's up to you, right? It's up to you how you're going to use it. But you might find helpful, for instance, the 6 projects today where the implementation is spread, where the participating countries are found in the globe, which geographical areas you might have in common, because you can filter always which types of organization you have in common. Long story short, you can play with the implementation figures around your projects, and they continue for the project that you might have a stronger innovation character, and you would like, and not only for all of you, for example, you have signed a consortium agreement, so questions around intellectual property, consortium agreement, ownership, and also innovation and patents and protection, you have a dedicated European help desk that you can seek advice with very fast response, free of charge. It's again an extra good service from the Commission to your interest, to use it in the appropriate time you find or questions you might have. I continue with the Horizon Results Booster, another recent platform launched by our services, that it's again a kind of free of charge service, consultation given to you. Here, you have to be very mindful when you're going to need it, again, when you move towards exploitation and how it can help you, but feel free to reach out to the service for questions and clarifications that you might need. And I'm going to end up with the Horizon Results platform. Apart from the automatic population and CORDIS, here it is again on your voluntary basis. For instance, if by synergies you like to pinpoint, as I have said with your critical mass, when we go down the pathway, I can recall from the previous meeting that you might have an expedition on preliminary results or ongoing results and outcomes you might have, and you would like to have a stronger message, you can explore this platform always either individually or jointly. This is a delicate balance that I think it's your task to strike and see what it makes the most benefit for you. And with that, I invite you always to stay in touch with us, with our media and web links. And once again, I would like to thank you for the attention and for having me in your meeting today. Thank you.
Thank you, Ioannis. Ginevra, you want to take the lead or no?
I don't know, please you go ahead and facilitate.
Okay, so now we're going to start the, I would say, the exchange and presenting the action and communication action that we have all implemented. So now it's for the EquityCancer-LA, so it's Sonia Diaz who's a project leader and who is going to make the presentation.
Okay, hello, how are you?
Hello.
So I'm trying to share my screen. Just a minute. Can you see the screen?
Yes, we can.
Okay, with the slides?
With the slide, yes.
Yeah, thank you. So good afternoon. I will present an overview of the project communication of the EquityCancer-LA project as mentioned. So just to give you an overview, our project started a year ago. It is a 5-year project coordinated by the Consortium de Salud y de Atención Social de Catalunya in Spain. It brings together 7 partners from 3 Latin American countries, Chile, Colombia, and Ecuador, and 3 European countries, Spain, Portugal, and Denmark. So the overall aim of the project is to evaluate the contextual and effectiveness of scaling up a multi-component integrated care intervention in order to improve early diagnosis of cancer in healthcare networks in the 3 LEA countries, Chile, Colombia, and Ecuador. To achieve this aim, we will conduct a participatory, interdisciplinary, and mixed methods implementation research, adopting a quasi-experimental design with intervention and control networks of health services in each Latin American countries, and also a case study design aimed to analyze access to early cancer diagnosis. So with this project, we expect to produce several outputs, including novel data about inequalities in access to early diagnosis, evidence to inform health policy design and the contextual effectiveness, also to produce a validated strategy for large-scale implementation in other countries, and digital tools to improve clinical practice and research on early cancer diagnosis. Sorry. So the project, and I will describe the work package 6 that is dedicated to dissemination of research results, communication, and capacity building. This work package has the duration of the whole project and is led by my institution in Portugal, together with the project coordinator and the support of Chile University. In this presentation, I will focus on dissemination and communication components of this work package. So overall, the aims are to raise public awareness, ensure maximum visibility of the project content and results, but also to announce and promote the project activities in a way that contributes to upgrade engagement potential. Our dissemination strategy is aimed at several groups of stakeholders, like policymakers, healthcare networks, health professionals, but also patients, and research community. And these are some examples of dissemination activities planned, like workshops and webinars, dissemination to national and international agencies and networks, training programs, e-tools, and scientific publications. A key element of the project that will contribute to achieve a greater impact is the participatory approach. Is the participatory approach applied at different levels: policy, engagement, management, health care practice, and research. So our dissemination strategy includes involving different stakeholders, as I mentioned, within knowledge co-production. And the idea is that stakeholders who have the influence and decision capacity to implement the knowledge generated. So this is the first, in the first year of the project, we produced 3 deliverables. The first one was the plan for dissemination and exploitation of the project results, which contain a description of dissemination objectives, strategy, phases, and activities. And this is a dynamic document to be updated as needed throughout the project. This plan serves as a guide for all partners on how to disseminate activities and outcomes in clear and accessible formats to reach diverse audiences. In this sense, the aim is to contribute to maximize the impact of the research by ensuring that the findings are disseminated throughout the whole process and in due time to different stakeholders. Second, the changes conducive to early diagnosis of cancer are implemented into health policy and practice. Other deliverables are also produced in the project, like project website and the data management plan, but due to the time limitations, I won't detail them for now. So I would like to give you just a quick overview of our communication tools and the activities so far. So this is our website that is active and includes also an internet page for the project partners. Just to mention also the tweet account of the project that was also created and has been used to promote events within the project. We have also created a leaflet with the project description and at the beginning and translated in different language to disseminate the project to national networks and partners. We had also a kickoff meeting of the project that it was held online and open to the public. We have also conducted public seminars by country partners to present the project to national health professionals and political authorities. And here are examples of the public seminar held in Ecuador and another one held in Colombia. An online symposium was also organized by the project coordinator and was dedicated to the topic proposals for addressing care integration in times of COVID-19, targeting health professionals in Spain and Latin America. Our networks play also a crucial role in the dissemination of the project, and the collaboration of EquityCancer-LA researchers with leading national and international organizations can ensure a rapid dissemination of results across the borders. And this is one example that has been our participation in the Global Alliance for Chronic Diseases and its events, such as the annual meeting and workshops. To finish, and regarding what you have asked about topics for our discussion, we could also hear some partners about what innovative tools and strategies do you recommend to help us? For example, how to reach and disseminate the results of the project to the general population besides what we have presented, but also to further engage and present information to stakeholders, but mostly important policymakers, and to increase the visibility of the project along media, like journalists, influencers, and so on. So this is the topics that we could discuss further. Thank you for your attention.
Thank you very much. I don't know if there are some questions from the audience at this stage.
Sorry, I might have one for Professor Diaz. It's a bit specific, so I'm not sure whether you'll be able to answer, but you did mention, of course, that your communication plan, the deliverable, is a so-called dynamic document, which also we also hope that, that it will be for our project. And based on your experience leading Work Package 6, did you manage to be able to kind of get feedback from all the other work packages and to really make it into dynamic document, or how do you guys go about it?
Yes, so in the beginning, when we elaborated the document, so we elaborated a draft proposal, and then we share with all the partners to receive some suggestions, and that went well. Probably not so much suggestions as we would like to have, but all the partners accepted, and it was a consensus document. So that's the first phases. I think it went well. The idea of having a dynamic document is that we already know that probably the project will evolve in ways that we were not expected. So the idea of not having as, although we have deliverable, we have sent it to the European Commission as the deliverable of the project. From the start, we discussed that it would be nice to be able to introduce changes according to the evolution of the project. So what we are expecting, and we are in the first year, so we haven't that experience because we haven't been able to change a lot the project. But what we have discussed is that when we think maybe we should introduce some news or changes, what we are going to do is to have an open dialogue with the partners, and we will be able to introduce new changes. So it's not really very strategic or rigid, is more according to the needs of the project or the suggestions of the partners. But what we have discussed is that probably, for example, in 2 years or in the middle, in some important phases of the project, we can restart a discussion with other partners, asking them if they would like to make some suggestions and including changes in the document. So the idea of dynamic is that we really don't want to have a closed document from the beginning of the project. And also one important approach in our project is the idea of participation of all partners. So we would like also to introduce that approach in the communication and in the specific part in the deliverable regarding the dissemination working plan.
Great, thanks a lot for your answer. And also another point, I just wanted to say congratulations on all these stakeholders and workshops, meetings that you guys did both in Latin America and Spain. I know how much effort goes into organizing events, especially if they're hybrid and all live. So congrats on that as well.
Thank you very much.
Thank you very much. I think we will have time for general discussion at the end. And as we are already slightly running out of time, I'm going to give the voice to Vanessa from the European Institute of Women's Health, who is in charge of the communication plans for the CBIG-SCREEN project.
Thanks, Mark. I'll just share my screen now. If you could let me know, can you all see that?
Perfect, thank you.
Great, thanks, Gina. Right, so good afternoon, everybody. Hello from Dublin. My name is Vanessa Moore. Like Mark said, I am with the European Institute of Women's Health. So we are obviously a partner of the CBIG-SCREEN project. So I'll just start with going through the project briefly. So it's a 5-year project. It started in March last year, 3.6 million euros funding from Horizon 2020. The main coordinator is INSERM, so Mark Bardot and his team. And we have 14 partners in 10 countries with the mission to accelerate the elimination of cervical cancer in Europe and to tackle inequalities and inequities in cervical cancer screening. The aim is to make screening more accessible and acceptable to vulnerable groups, attract them to cervical cancer programs, and to retain them from, all the way from the initial test up to treatment and beyond, really. To achieve this, the project aims to create a knowledge framework around barriers to cervical cancer screening. 3 pilot interventions will also take place in Estonia, Portugal, and Romania. And the outputs from all this will be cervical cancer screening programs tailored to vulnerable, underserved groups and policy recommendations to specifically address all this. So how do we go about communicating all of this? Well, I'll just show you this. I'm not going to delve too much into detail in this, but it's just a good overview of the project. I'm sure you remember this from the last meet and greet, so I'm sure it's fresh in your mind what exactly we're doing, but it just to kind of illustrates very well kind of how complex a project can be, and what should you actually focus on, and if you have different outputs coming out at different times, and how do you go about to actually deal with all of that, and you have very different your awareness raising on one side, but you're also trying to communicate very specific findings or recommendations on another. So it's just a good illustration kind of when you're trying to visualize, I suppose, your aims and deliverables, how exactly can you do that? So just to give you an overview of what we've done, our deliverable so far has been generally our communication tool. So one of the very first one that INSERM created was one of the most basic, but also most important one, our visual identity. So our logo, graphical charts, templates, posters and project leaflets, again, outlining what we're doing, this overview of what it is we're trying to achieve. You can see an example there on the slide of one of the leaflets that are available from the website. It's just a great way to explain the project a lot better, just to communicate what's there and to show it in a much more appealing way, and easier to digest as well for the people who are receiving the information. I mentioned the website, which is one of the key dissemination tools really for the project. It's one of the main interfaces for the stakeholders. It's also somewhere that we can refer back to when we try to advocate the project on social media. It's where we can post news and updates just like we would on social media, but it just contains that little bit more maybe in-depth information. It will be, I suppose, a depository in a way for a lot of what we do throughout the project. So it's really kind of an anchor of a lot of what we'll be doing. It also contains the CBIG-SCREEN extranet, which is the partners portal where we can access just very practical project related stuff, all the templates, for example, also all the project details, all the deliverables so far, the partner details, whatever the things that you need in a project like this. So it's being run by INSERM, and it's very, very useful. Another deliverable that we had at the start of the project was our dissemination and communication plan. I put ongoing on the slide here because, much like Sonia, it's like Gina mentioned as well, it's a live document, it's a dynamic document. So we've submitted it as a deliverable, but as is illustrated here by this the figure there, we're kind of constantly revising it, I suppose, or readjusting what might need changing, and what with partner input, hopefully, what will we what specific targets do we do, what works, what doesn't work, that kind of thing. The plan also outlines a variety of, obviously, our main communication aims and objectives, our primary target groups, secondary target groups, the specific target areas that we have for our communications. We have a specific table outlining partner responsibilities, and also to facilitate for partners where they can participate, of their own free will, and also where they're kind of obliged to really, everybody to work together. And it's just to facilitate for the partners to see that, so it's easier for them. It also outlines our social media activity, newsletters, policy briefs. We have 3 roundtable meetings taking place over the life of the project in the European Parliament, so it outlines that as well. Our plan for our scientific publications, what strategy, which ones are we specifically targeting, what's the policy around authorship and those kind of things. So it's obviously a very, very useful tool, and it's something that like I said, it's a live document. It will be, kept going throughout the project in the sense that it will be revised and, maybe added to and those kind of things. So how has our experience been so far? So what have we done? We have established and also ongoing work on our social media accounts. So we decided to focus mainly on Twitter and LinkedIn, just to have, just to focus better on, we thought that they were the two most appropriate platforms to use for what we're to convey. So we're trying to keep them as active as possible and engaging as much as possible with people through them. We've also had the famous meet and greet. So this is obviously the second one. A really, really great initiative from ECL that we're, super happy to support and take part in. And it's great to see it growing as well. And that other projects are interested to participate. I think it just really shows the, the will that exists out there to really kind of work together, which is great. And it's really something super positive. So, thank you again to ECL for organizing that. It's really useful. What we also did was for Cervical Cancer Awareness Month, we wanted to obviously, advertise for ourselves, so to say, and kind of draw attention to the CBIG-SCREEN project, but we also wanted to, draw attention to cervical cancer in general. So we did 2 stakeholder interviews that we put on social media. So we had one with John Ryan, who's the Director of Public Health in DG Santé, and then one with Caroline Mason-Mohan, who's the Director of Public Health in the National Screening Service in Ireland. And it was great to get 2 kind of very different perspectives. John spoke a lot about the EU Cancer Plan and kind of where a project like CBIG-SCREEN might end up in that. Do we want to get involved? These kind of things, how we can work together, which is obviously extremely useful because it benefits both of us. Caroline Mason-Mohan spoke a lot about vulnerable groups. There are specific groups in Ireland, obviously, that would be very vulnerable as well. Their experience of targeting them, and they're actually starting a project at the moment that deals with trying to target specifically members of the traveling community in Ireland, which is an extremely disadvantaged group. So, but just very interesting to see, local pictures as well of what goes on. We also did snapshot interviews with some partners, just to present some of the partners. Who exactly are we? What do we do? What are our contributions to the project, and what is it we're hoping to achieve? At a webinar in February where we just called it simply Introduction to CBIG-SCREEN. So it was pretty much what it said on the tin. It was an introduction to the project where we explained, what it was, what we're trying to achieve, the importance of it, and why it's very relevant. It was hosted by, I'm not going to pronounce this correctly, Sirpa Pietikäinen. She's a Finnish MEP. She's a member of MEPs Against Cancer, and she's a great supporter of these type of projects. So we ended up having over 60 attendees from 21 different countries, which was great. It was more than we were hoping for, so we were thrilled with that outcome. And it was just a great opportunity as well to host something like this and to kind of get a foot in the door a little bit in terms of our roundtables that are coming up later. So it was a really good experience. And so what does the future hold for us? Well, the near future anyway. So we're going to continue our continuation of these snapshot interviews of the project progress. At the moment, some of the countries are hosting collaborative user boards, which are interview or sessions really with kind of a micro, meso, and macro levels with participants in the vulnerable women, maybe some stakeholders, policymakers. So it's really kind of very much a cross-cut of everybody that the project wants to target. So just to get as much information as possible out about them. And it's really interesting to hear the partners' own experiences of how these have gone. So we've had 1 or 2 videos, I think, about that, and there's a few more in the pipeline. So they'll be coming out during the summer as the Cubs progress. And we're also planning a similar series, but highlighting the specifically vulnerable, marginalized groups. Either an interview with partners who kind of knows, a lot about these, specifically about one group, or ideally, member of the specific group itself, whether it's, I don't know, women living with HIV or, women, incarcerated women, whatever. It's something that will be taking place. It'll probably go on kind of throughout the year. It'll be a very ongoing thing, but I think it's important to give these specific groups their own voice. In CERN, we're also finalizing a how to get involved section on the website, which is targeting the 3 main key stakeholder groups. And there's a 1-page information sheet that will be made available in several languages. Again, just mirror that it goes on in a lot of different countries. Our first online newsletter is coming up, very exciting. And we're also hosting our first roundtable in the European Parliament. That will take place in September 2022. For now, I don't want to jinx anything, but it looks like it will take place in person, which will be great as well. And it will target stakeholders, policymakers, and politicians. So you'll be hearing a lot more about that when kind of all the plans are solidified. So watch this space. I'm nearly finished now, sorry, I'm just aware of time. Just about the meet and greet collaboration. So like I said, it's a fantastic initiative. We're super happy to be part of it. In terms of, how we can share and kind of help each other, we'd obviously be more than happy to share any kind of tools or, specific expertise that we have. And also, just tell us how, can we help your project in any way, or maybe you can help ours. There's plenty of ways we can do it. Just, as an example, reach out if you're hosting an event or webinar. We'll obviously happily attend, but, we'll post about it. There's plenty of different ways we can help each other. Just in the interest of time, I'll finish there. So thank you very much. That's all the languages of the partner countries. If I got them wrong, I'm sorry. Google Translate is to blame. So I think that's back to you now, Mark. Thanks very much, unless anybody has any questions.
Thank you very much. Yes. Yeah. Are there any questions? Yeah, I'm biased, but I would like to thank Vanessa and because you have been and you are really, really active, and I think really making the effort to communicate is essential. You have been discussing, if I may ask a question, the targeting and reaching the vulnerable groups, because you have been interviewing partners from the project. You have in mind to interact with the policymakers at the European Parliament, but what about the vulnerable groups?
Yeah, so we're hoping that this kind of series that we're planning to highlight, the specific, the specifically disadvantaged groups, the ones that are kind of, I suppose, specifically disadvantaged, that we'd like to maybe not just have somebody who's, an expert in the area, but actually get, one of the women themselves to speak and to say, what exactly was very difficult for them, or just their experience in general. So it's, I suppose it's still very much in the planning stages, but that's, we really want to capture their voices, I guess, and to not have a proxy speaking for them, but to rather have their, their own subjective experiences, and, who better to share that than those specific women themselves. So hopefully we'll be able to do that for all of the groups, really.
And one question, last question about I would say the interaction with the project, to interact with I would say the policymakers and the deciders, because once again, based on the experience we have had during the CBIG-SCREEN project in France, we found that it was really difficult to connect the policymakers with the macro level. And I think that we need to unify our effort. Okay, it's not me as a researcher who's going to ask you to, as a health ministry or a director of health in France. We are, I would say, a group of people who know, and that we need to interact with you. You need to hear our expectation. You need to hear the fact that we need to interact to build policies which are quite efficient and may reach the people we really need and want to reach. So yeah. The question was about finding a way to communicate on behalf of 6 projects and try to interact with the policymakers at the European level and also at national levels.
Yeah, sorry, Mark, I don't know, was it my internet, but you were breaking up a little bit there. So thank you for repeating the question. Yeah, I mean, I do think, to be honest, it's it's trite, but there genuinely is strength in numbers. I think just the fact that we do have this collaboration already, that, if you send a letter where you have 6 signatories as opposed to 1, it does make a big difference. I think obviously you need to know maybe where to target, where is there specific interest in cancer, for example. And we have the very useful MEPs for Cancer group. If you know that people are in that, you're saying, okay, well, that's a good start. Sometimes you could just get lucky as well. I know when we said, we try to email John Ryan. Ryan? And we said, well, try John Ryan. And he emailed back within 10 minutes and said, yeah, absolutely, interview me. We were delighted. I don't know, was it the Irish connection? But it was, you know, a nice surprise, obviously. I do think, though, collaborating like this is a huge, it's a hugely important thing. And I think if there's, for example, you know, one specific area that we really want to highlight, or if there's, you know, something that comes up that's, you know, very concerning or whatever, I do think that doing stuff, issuing a communication, for example, together is going to make a big difference, as opposed to just one little project. I don't know if that answers your question, but that's my take anyway.
You did indeed. Thank you very much, Vanessa.
Thank you.
I don't know if there are some other questions. If that is not the case, I'm going to give the floor to PRESCRIP-TEC, Oscar Casanova. I saw you.
Yes.
Yeah.
Thank you, Mike. I will share my screen. I hope you can all see my screen, right?
Yes, we can.
Okay. Good afternoon. I'm Oscar Casanova from Conaxis. We are the company in charge of the communication component of PRESCRIP-TEC project. PRESCRIP-TEC is a 3-year project. We started on February 2021. We are almost in the middle of the project now at this month. The total funding is 3.2 million euros, and the European Union contribution is more or less 90%, and the other 10% of the budget comes from the government of India. We are 18 consortium partners. The University Medical Center of Groningen is the project coordinator, and 17 more organizations. Within, we are Conaxis, the communication leader, and we are in charge of community mobilization and dissemination and exploitation of results. The project is taking place in 4 target countries, Bangladesh and India in Asia, Slovakia here in the European Union, and Uganda in Africa. And the main goal of the PRESCRIP-TEC project is to increase the adoption of cervical cancer screening in those places of the world where there are not enough resources to perform a pap smear test, because they don't have the equipment, or they don't have maybe the gynecologist. So in those hard to reach setting of the world, we are trying to increase the adoption of cervical cancer through innovative cervical cancer screening, more cost effective. Regarding the communication related activities, we are in 3 main areas. The institutional, we are performing work in 3 main areas: institutional communication, community mobilization, and dissemination and exploitation of results. Institutional communication is everything that has to do with the official communication of PRESCRIP-TEC project, but we also need to mobilize the communities in the beneficiary countries. We need them to know about PRESCRIP-TEC, to know about the importance of the prevention on cervical cancer related disease. And once we have outcomes and we have results from the project, it is also very important to disseminate them to the target communities. Institutional communication, we started creating a brand around PRESCRIP-TEC project, corporate image, logotype, also brand guidelines. I have here the document. I can show you the document of brand guidelines. So it's not only the logotype, but also that everyone who is interested can know about the vision, the mission of the project. We have some infographics, also how to use the logotype. If you need to create the logo from scratch, you can, following these guidelines, how to use it together with the European Union logo, the chromatic code, the colors that we are going to use, the font family, and everything. We also create templates for presentations. This presentation that you are seeing right now is based on a template that we create at the beginning of the project. But we also create presentation for Word documents, for reports, internal and external report, for press releases, and other kind of documents. And the goal is that all communication from PRESCRIP-TEC are consistent, and this is the way that they are easily identifiable by the target audiences. So we try always to make all the communication following the brand guidelines and the corporate image of PRESCRIP-TEC. And another component of the institutional communication that we have been working on is the design of training materials. An important part of the project is to train the health worker, the local health worker in the beneficiary regions of the countries we are working. And for training those health workers, we have also designed with the help of our Slovakian partners, the University of Truni, the training materials. This is also an example of training material that you can see here, that we made the layout, the design. We also designed some icons and this kind of drawings that we are very happy to share it with you if you maybe for your project or for some activities that you are performing, if you need something related to these these images, you can always ask for them, and we will be very happy to share it with you in any format, because we want to open all the materials that we have designed to the community. So we will be very happy to share everything with you if you find this useful. The community mobilization is the second component of the communication activities, is the component where we are focusing right now, because with the institutional communication, we are almost finished, and we didn't start yet with the exploitation and dissemination of results. So we are very focused on community mobilization. And the community mobilization, the main product that we have designed are around our community mobilization toolkit. All those products are available on our website. If you go to our website, PRESCRIP-TEC.org, and you go under resource, you have here communication toolkit, and in this web page, everything is available to the general public, and of course to you if you find these materials useful also for your project. Here is the logotype and brand guidelines that I already go through them. We also create some landing pages. Beside the project website, we create landing pages for each country. These landing pages are focused on community mobilization. And the main goal of the landing pages is to inform the beneficiary or the potential beneficiary women about the importance of get informed on prevention of cervical cancer, also the importance of get screened to prevent cervical cancer, some videos and posters also that we have designed, and very important also the way to get in contact with our partner, in this case in Bangladesh is Friendship, how you can get in contact to the health facilities so the beneficiary women can perform and screen and prevent cervical cancer. We drive traffic to these landing pages through advertising campaigns on social media. Especially we are performing advertising campaigns on Facebook ads, Twitter ads, also Google ads. We have a budget for that. And this is also, I think, very interesting, because this social media platform allows to make a very targeted advertising, so we can address our message to a very specific public. In this case, the women who are living in the areas where we are working in Bangladesh, with a specific age range and a specific interest that we know that like this we can cover all the most of the women that could be the beneficiary for this project. Also, we have designed poster, country fact sheets that we have designed especially for reaching the policymakers. I will open this fact sheet of India, for example. And in this fact sheet, you will see that we highlight that each day more than 200 women die from cervical cancer in India. We have some data, specific data about the country of India, an infographic of how the path of cervical cancer, how an HPV infection is the start for precancerous lesions and that lead to cervical cancer if you don't do anything about it. And we believe this is also very interesting for reaching policymakers in each country. We have also produced some videos. This is short videos to share on social media. This is also in line with the World Health Organization guidelines of 1970-90. And we have some of them for that we also promote on social media. And we also produce a main video that explains all what PRESCRIP-TEC is about in 2 minutes. It's a video with voiceover. And all those videos, as I said, are available on the internet. We also have some templates for Twitter, Facebook, and LinkedIn posts already ready to be published. So all the partners of PRESCRIP-TEC can go here to the website, take this and publish into their social media channels. And also, if you are willing to do and you want to, you can just go to the PRESCRIP-TEC website, take this post and share it on your social media. It's just ready to be shared on the social media. And yeah, another important activity or product that we have in community mobilization that maybe can be interesting also for you is the news section of the website, which is, we think, quite dynamic and quite active. We publish news about the PRESCRIP-TEC project, of course, the progress of the project, the main news, the main events that we have around PRESCRIP-TEC, but also we publish here news about cervical cancer in general, events or news about cervical cancer that are outside PRESCRIP-TEC project, but are relevant for the PRESCRIP-TEC community in this case. So we will also be very happy to publish some information about other related projects, about your project here in our website on PRESCRIP-TEC. And I think it could be interesting for you if you have an article or you are posting a blog post in your website. You can always contact us and maybe we can share it and we can include it also in our website. I think that would be an interesting synergy to reach more people. And we are also sending quarterly e-newsletter to the people who subscribe to the newsletter. But once we send the newsletter, we also upload all the newsletter into the website. So if you go to resource and newsletter, you will see all the newsletter that we have produced on PRESCRIP-TEC project. The newsletters will be now are more about community mobilization, but there will be more and more about dissemination and exploitation of results as the project progress and we will start to have results. For the exploitation and dissemination of results, we will start hopefully at the end of this year, and we will focus 2023 on dissemination and exploitation of results. And we will create an exploitation of results toolkit that will be very similar to the one that you have seen about community mobilization, but of course with another goals and another target population. We will create a scientific poster, videos, press release, blog post, and other materials that could be relevant for this new target audience. The goal is to, of course, to reach the academia, other research, policymakers, but also the general public, everyone that can use the PRESCRIP-TEC results. The main goal of PRESCRIP-TEC is that the results, if we are successful and we discover that we can perform screening in those settings of the world where the pap smear screen cannot be performed and is successful, we would like to replicate those results in another countries, in another places with another institution, and for that it's very important to disseminate the results. We will also make activities related to advocacy and knowledge translation. We are thinking about also conducting some webinars, events, trialogues that involve policymakers, research and health workers, so all the people can talk together. And for that also, I think it would be very interesting if we can maybe to manage to see a webinar together between other projects. So maybe that would attract more people, and that would be more efficient if we can organize a webinar together, not just for PRESCRIP-TEC, but together with other projects. And this is also related to the Horizon Results Booster. PRESCRIP-TEC made an application. The application has been approved. The CBIG-SCREEN project told us that they are also interested in being part of this initiative of the European Commission. So we have included CBIG-SCREEN also in our application. For the moment, we are two projects, PRESCRIP-TEC and CBIG-SCREEN, but we will be very happy to include other projects if you are interested in being part of this project group, because also the Result Booster platform, they foster the synergies, and they prefer if we are a larger group and we are several projects, because we all can benefit together from the program. They will, I am not yet sure how it's going to be, but I think there are going to be periodic meetings with the Result Booster people. There will be consultants and meetings that will help us to disseminate the results of our projects. And that's it. I invite you to follow us on Twitter, Facebook, and LinkedIn, are the social media channels where we are present. Also to subscribe to the newsletter if you want to be up to date with all the news of the PRESCRIP-TEC project. You also have here the URL of our website, where all the information and all the communication materials are public, so you can use them as you wish. And if you have any doubt or you need anything in a specific format, we are also happy to help if we can, because the goal, as I said, is to make all this material public and to be used for as much people as possible. You can always contact us by mail. Dr. Kot is the project coordinator from the University Medical Center of Groningen, or myself, Oscar Casanova, and here you have my email, and now I will be happy to answer all the questions you may have now in person or later by mail, as you prefer. Thank you.
Thank you very much. Thank you. That was really interesting. Do you have some question?
I think we can take them later because we're running a bit out of time, but I have lots of comments. And first thing is, of course, congratulations for the great work that PRESCRIP-TEC has done on the communications. And we are very excited to have Conlaxis here, because they are a communication agency. And I think it's one of the only projects that really have a communication agency. So I think, you know, we look up to you guys and to your communications, and we will ensure that we share the communication toolkit and all the links that Oscar has shared. But now I think we shall proceed.
Yes. Thank you very much. So we're quite late. Now it's time for EUTOPIA-EAST.
Yes, thank you.
Thanks to you. Sorry for being late.
Well, I think I have a brief presentation. So I will present about EUTOPIA-EAST. This project also has a duration of 5 years. We started a year ago. The funding is 3 million euros, and it's coordinated by Erasmus MC. This project has 8 partners in 7 countries, and the aim is to implement breast, cervical, and colorectal screening. cancer screening in 3 exemplary Eastern European countries, and also to disseminate good practice to build capacity in the other Eastern European countries and also Mediterranean countries. And we do this by developing roadmaps, implementation, monitoring, evaluation, and also capacity building. We don't really have a work package communication and dissemination, but we have a work package 8 capacity building, which I will tell more about. So the goal is to disseminate good practice to build capacity in other Eastern European and Mediterranean countries. We do this with a collection of web-based tools. We developed those tools already in a previous project, but we will further develop those tools in the coming years. So we have tools for monitoring and evaluation a screening program. So the program coordinators, for example, of each country can use their own data to really monitor their program and to compare with other European countries, but also to evaluate their program and to predict how many deaths are prevented, for example, in the coming years, and how many overdiagnoses they have, so the more difficult outcomes of a screening program. We also have tools to analyze the barriers to improve a program, and tools to analyze who the stakeholders are, and roadmaps. So how can you improve your own screening program? We will organize 2 workshops for researchers, program managers, and policymakers of all Eastern European countries on key elements of screening. So, and in these workshops, they can also share good practice. So these 2 workshops we will organize a little bit at the end of the project, so that we also have the experience about the implementation we are going to do in 3 exemplary countries. And yeah, people can really share then their experiences. What we also would like to do is to organize some roundtable discussions, especially in the exemplary countries. So in those roundtable discussions, we will invite stakeholders of all different kinds to discuss how to scale up the more pilot type of approach we are using now, to more scale it up to the national level. So as I said, we will organize 2 workshops later on in the project, but in our previous project, we also organized 4 workshops. So we have some experience with that, which I can share now. So we had 4 workshops with more than 100 participants at each workshop, with an interactive program consisting of lectures, sharing of experiences. And when they shared experiences, we divided all the people in groups per cancer site or per European region, so that they are really having the same background and the same kind of problems and barriers they face, and same solutions they can use. So we use the tools we developed, so we demonstrate those, and people could practice with the tools during the workshops. And also in the workshops, there was plenty of room for networking, which people very much enjoyed. I think the success of organizing a good workshop is the preparation. So we had really extensive preparations. We had for each session in the weeks before a call with all the speakers of that session to really discuss what is the goal of this session, what do we want to learn the participants, who is the audience, and to really coordinate their presentations. Also, we had surveys. So after the workshop, we asked feedback of all the participants of each session, and also to give some suggestions for improvement and expectations they have for the next workshop. And we learned a lot from those surveys. Especially one of the points was that there was not enough time for networking in the first workshop, so we extended that in the next ones. So about the question, what we can share and what we would like to know from others. What we can share, I think, is especially the experience in organizing workshops. And what we would like to know is how to organize roundtable discussions with many different stakeholders, because we have not much experience with that. So especially, how to make an agenda, how to, what topics to discuss, how to involve everybody in the discussion, and who to invite, such questions. So we are also very much, we look forward to the experience of CBIG-SCREEN for their roundtable in September. I think that was all. Yes.
Thank you very much, Evelyn. So of course we'll be happy to share with you what you want to know, and clearly I think that what we have learned from the CUBs, so the collaborative user boards, is that it's sometimes difficult to bring together the three levels that Geneva mentioned: the micro, meso, and macro. It's sometimes some decided to not just to mix micro and meso and macro, but not all together. It's something, of course, that can be discussed. You mentioned that you had workshop with the workshop with the policymakers. What level of policymakers did you involve in your workshop?
Yeah, that's indeed the difficulty, how to find the right policymakers. So indeed, the persons you have to involve are the ones who write a report that is on the desk of the Minister of Health about screening. I'm not really sure we really had those people, but it's always difficult to know exactly what their role is. So with what policymakers we did have.
Okay.
It's hard to really explain what they were, but somewhere between the minister and the lowest people in.
Okay, but were they really the one who are in charge of designing the program?
Yeah, so that's the difficulty. We are not really sure. Some of them are, but some of them probably are less. Yeah.
And I think it's something that we may share together, the best way to reach out to the people we really want to reach out, and make sure that we are not being in contact with only the substitute of the substitute.
Yeah, it's really the difficulty to find the right persons. We never are sure if we really have the right persons who have the influence. Yeah.
Okay. Further questions from the audience?
I think I can elaborate on a few points afterwards, but I'll leave it to the what.
Okay, so thank you very much, Evelyn. Now it's time for us to hear about CANCERLESS, and that's Dr. Beatriz Valina.
Hello, good morning. Can you hear me well?
We can see you, and we can see your screen.
Can you hear me?
Yes.
Okay, perfect. I will share my screen. I think that my presentation will be brief. So, okay, perfect. So, hello and good afternoon. I'm Beatriz Valina from the CANCERLESS project. And Cabelos, the company participating in the project in the communication and dissemination work package, and also in the evaluation of the social impact of the project. Our project title is Cancer Prevention and Early Detection among the Homeless Population in Europe, co-adapting and implementing the Health Navigator model, and our website is cancerlet.eu. Our project has a duration of 3 years, and we are 11 partners. 4 of them are universities or research institutions, 2 are public authorities, 2 NGOs, 1 company, my company, and 2 non-profit international platforms or networks, among them IFIC, the International Foundation for Integrated Care, having a relevant role in the dissemination and communication. Our mission or vision is to prevent cancer through the early diagnosis, specifically among homeless populations. So our project is focused on primary prevention of cancer in highly marginalized groups. So our general objective is to adapt, validate, and scale up the Health Navigator model as the primary cancer prevention tool, the main tool to be implemented in order to foster and enhance the access to this deprived group to high quality healthcare services. So the Health Navigator model will be implemented in 4 pilot cities, which are Madrid, Vienna, London, and Athens. And we will produce several results, but the main ones are the adaptation and the guidelines of the Health Navigator model, the policy recommendations for cancer screening aimed at very deprived populations and marginalized, training materials and capacity building materials. We are in progress at this stage. A scale-up strategy and the urban health communication strategy, which is specifically focused on homeless persons and is integrated within the pilot phase itself rather than within the communication and dissemination. I will explain it later. We are now in the month 11 of the project. So we are starting the pilot phase and working in depth with the capacity building for the pilot managers in the 4 sites. The objectives of the dissemination and the communication has been differentiated. So the dissemination is mainly focused on widespreading the project and fostering the sustainability and the long-term feasibility of the project results. And the communication is mainly addressed to policymakers, NGOs, and of course, the general society, and the objective is to raise the engagement of the non-homeless persons, in fact. So we have 4 different tasks within the work package 6. The first one is the strategy, the communication and dissemination strategy. The second is a different strategy, which is the strategic urban health communication for the homeless populations. The third are the activities in dissemination and communication, and the 4th, the scalability of the model and the scale-up strategy, producing 4 parallel deliverables in accordance with the task. The second task is particularly thought and difficult because comprise the alliance between the work package 4, which is the pilot phase, directly engaging homeless persons and community leaders, and also social and healthcare professionals, and the work package 6. So as a result of our academic expertise in Cabeloce, we prepared also a locally focused and culturally tailored strategy for being adapted to each pilot manager, its partner conducting and implementing the pilot in the pilot site, preparing campaigns and networking activities with community leaders and professionals working with the communities or in touch with these communities, because persons living in homelessness tend to be highly reluctant to be reached by public authorities, and healthcare professionals can be seen by them as public authorities, and the reluctance is perfectly understandable. So we need to work together with the community leaders, which are homeless persons themselves, and also professionals working with them in order to build trust and make them feel comfortable and also represented, and also obtain support from them for widespreading messages and key messages for the general society aimed at overcoming the stigma they might be facing right now. So with a view of horizontality in the development of the project, we specifically separate the task of communication for homeless populations from the other ones, because the target group is very particular and need particular consideration also within the pilot phase. So in general terms, because the urban health communication for the homeless communities is mainly face-to-face, and utilizing networking and alliances with local leaders and NGOs and social workers, the general means are sustained in the whole society strategy, so multi-channel activities, and we use online social media channels and offline general dissemination and communication channels, for example, press releases and newspapers at local level, workshops and events, networking like this event, and also the attendance to trade fairs for health professionals, as in general, workshops, non-academic workshops, and EU events in the next months, once we have results from the pilot phase to show. And our strategy for disseminating and communicating the project also relies on the Center for Communication Programs at the Johns Hopkins University. I think that I link the source within the PowerPoint. So if the PowerPoint is shared with the whole attendance after the meeting, you can access to this reference, and otherwise you can write me and I can send you the complete reference. So our main aims participating in this event is to build partnerships outside the project consortium itself. For example, to organize joint seminars or joint workshops in conferences or events that will be held the next year or the following one, to write or recite guest posts about related topic. We are all working on cancer, and vast majority of us are working with vulnerable populations, so social determinants of health and health inequalities in cancer is a common topic for preparing posts. To share our URLs or our respective website and social media channels in our Instagram or Twitter or so on and so forth. Mutual cooperation, we are open to cooperate with you in different ways you can imagine and we cannot now predict. And collaborative press releases, if applicable, or even collaborative scientific articles, if applicable. For example, I don't know, if you aim to study the cancer screening for hard-to-reach groups, it may be a plausible scientific article, but we can discuss that and reach a common conclusion. So the takeaways of this presentation are that our project is focused on primary prevention. We are now working on presenting a second one on case management of current cancer diagnosis in homeless populations, culturally tailored and aiming at horizontality and knowledge sharing with homeless populations participating in the pilot phase, communication campaigns and major effort doing by all partners, and moreover those involved in the management of each pilot site. And we are fully open to diverse ways to collaborate and mutually engage. So thank you very much. You have my Twitter account and my email. I can share it with you if you need, and I remain at your disposal. Thank you very much.
Thank you very much. Question? Maybe we just want to comment on your last slide, or the previous last slide where you mentioned the writing article together. I think that we may try to maybe publish some kind of position paper on the communication activities, because we're all focusing on I would say either outreach or vulnerable groups, and I think that we may so I don't know if we have the material to do that, but trying to publish some kind of position paper, but all the issue we have been highlighting, so reaching the audience, so that means the people who want to help, or the the policymaker, the stakeholders. So I think it's something we can think about.
Yeah, I think that it will be very, very interesting. In fact, my PhD research was about recruitment and reaching and engaging vulnerable populations. And I think that is lacking a compilation of success case of European funded projects, explaining how they reach and involve within the pilot phase the vulnerable groups they are trying to engage. And evidence is needed on this field. So a position paper will be great, even a conventional paper, but it requires a lot of time and effort. But position papers are lighter in terms of workload. And I think these are needed for the scientific community.
Yes, I think, presenting the communication activity we've all been developing within our program, the aims, the way to measure whether or not what's going to reach the audience we want to reach. So I think we need to think about that. That is a very smart idea.
I think so. I think your idea is great.
That was your idea, almost. Thank you very much.
I will liaise with Igor, the project coordinator, for organizing the position paper or even conventional paper, success practice paper or something like that. We will discuss that. We'll have a meeting tomorrow morning, so I will comment him about this. Yeah.
Thank you very much.
You're welcome.
No further questions. So it's time for the last presentation, and we're almost on time. So it's Chile, Dr. Ellen.
Good morning, good afternoon.
Good afternoon.
Let's see if I can share my screen. Can you see my screen?
Yes, we can.
Okay, so I will present the communication and dissemination part of Chile, the community-based HPV screening implementation in low and middle-income countries. So very quickly, our project is a project of 5 years. We are coordinating it from Ghent University on. We have 12 partners in 11 countries. And we aim to optimize cervical cancer screening in low and middle income countries. And we do that by basically 2 steps. One is, or 3 steps here in activities. We start with a situation analysis in the 4 countries where we work, which are Cambodia, Uganda, Ethiopia, and Mozambique. So we do current situation analysis. We look at the current barriers. What are the possibilities for women to go for VIA, to go for pap smear, and so on. And we do so because in the end, we want to implement a new screening device that is a point of care device based on self-sampling. It's an HPV DNA test. We also, part of the project is also adapting that new screening tool so that it becomes more affordable for low and middle income countries. And so, as I said, we then want to implement it. And so the first step, the situation analysis, is there to give us an idea how to best implement it, how to best offer that new screening tool to women, while the last step is then that pilot study where we validate and implement the new tool. So basically, we have 2 main outcomes, let's say. One is we want to have we will have the new self-sampling device, affordable and adapted to the countries. And the other big output is that we will have a screening intervention tailored to the context of each of the countries with a point of care device based on self-sampling. So if we then think about the aims regarding communication and dissemination and so on, in Chile, we have a work package on dissemination, valorization, and policy translation. And also in the work package management and coordination, there are some goals and aims regarding communication. So maybe the first one, I think we all are looking for collaboration with national stakeholders to ensure appropriate and sustainable interventions. In the Chile project, I think in the first step, we want to really collaborate with them and involve them in the project. Later on, we believe that through these connections, we will have a more sustainable project, and hopefully by involving them now, they will later on still think about our point of care device that might be implemented or better said, that might become part of their national guidelines. So how do we do that? We asked each of the 4 countries to set up an implementation board in which they bring together national stakeholders. So in each of these boards, we have people from national referral hospitals, so gynecologists and experts in cervical cancer screening in the country. We have people from NGOs or international organizations working in the country. We try to reach out also to people of Ministry of Health. The setup of this implementation board, I think it's very important, but I have to also mention that it's not easy for the partners to set this up, because you're basically bringing together people who are very busy. So it's challenging, but I think it's very important to have them on board, because it really opens doors now to implement the project, but also later on to disseminate results and hopefully include point of care testing in national guidelines. So we ask them to organize also national kickoff meetings where they present the project. And so throughout the project, the implementation board will often be contacted. They will reach out to that board for them to revise and review protocols, for them to think about challenges in the field, how to solve them. So we really have a lot of people, I think, on board from the start of the project on. Then the next aim is to disseminate the results of the Chile project. I think we all, of course, want to disseminate our results at national, European, and international level. We have, as I said, implementation board that can help us with that. We have press releases at the start and end of the project. We have a website, of course, where we will you mentioned anything new regarding the project, or publications will be, scientific publications will be published there, but also publications in national journals or national newspapers or so on. And then we also have a scientific advisory board. These are external researchers. We now have 2. We aim to still invite some more. So these are external researchers, again, for they are invited during consortium meetings and so on. And in previous project Elevate, it has been shown very useful to have like somebody from outside to review your protocols. And of course, somehow you rely then also on their scientific networks for communication and dissemination of results. So at this moment, we have somebody from Burundi and somebody from Malaysia. And we intend to still invite somebody from, we were thinking the Clinton Foundation or WHO cervical cancer screening unit. So we're still thinking about that, because the people we have now are more scientific, and since Chile has a very strong goal to translate our results later on in policy guidelines, we would like to have somebody who can also give advice on that in that area. I think maybe quickly in terms of dissemination and communication, the channels that we foresee are our own professional networks, of course, but we also we work and I believe that by working in the community with community leaders, with working with national referral hospitals and so on, with local NGOs that will be they will participate in our research project, but they will also later on be the ones to whom we go for feedback, among who we share our results. So I think they're also definitely part of the audience and channels that we can use for dissemination of results, so kind of our own participants. Exhibitions and fairs are more for the technical partners. As I said, we develop also a new tool, or we adapt the new tool. So they will use also conferences and fairs to position the new screening tool. Maybe one that I would like to point out also in terms of national policy advisory boards and organizations, because health is more a Belgian platform of public health experts, that we will definitely also share our results with, but Answer is lost in my, here it is, Answer. It's, I know, I remember. It's a group of researchers that are really focused on translating knowledge into policy and practice. So it's a project, it's a setup from Ghent University. And so they have a lot of activities. They work very closely with UNFPA as well. It's a bit small, but there are already 39 academics and nonprofit institutions that they bring together. They have several meetings a year. They set up various conferences and so on. So we definitely will reach out to them once we have our once we're at a further stage in the projects, to make sure that we can rely on their experience to translate our results into policy recommendations and into practice. So this is what I wanted to mention about that. Fourth aim is to properly manage the data and intellectual property generated in the Chile project. It might be a bit further in the future. I think the business plan, financial plan is definitely more something that the technical partners are looking into. When it comes to the public health, as is already mentioned before, we will also have, of course, a data management plan. We intend to have open access when it comes to all the data. We also are developing a publication plan and policy, so for the dissemination of final results. And our technical partners work on the commercialization roadmap of that new tool, but as I said, that will be a bit further away in the future. And then last, I also added this aim to ensure adequate qualitative communication and reporting among all the consortium partners and within with the European Commission. This might be more related with internal communication, but I thought it was also maybe interesting to share. So in Chile, we have quite a setup. Because the project somehow has two main components. There's the adaptation of that new screening tool, and there's the implementation of that new screening tool. So we have a public health team and a technical team, and so we have somehow two coordinators, one for the public health team and the technical team. And so internally, we very often come together at this level, so that there's not always need to bring everybody together. Of course, we have also consortium meetings, but I think we can have a very often and fluid communication by this setup. As I said, we also have our scientific advisory board locally. There's the implementation board. So I think we somehow try to make sure that the communication flows between these two components. And with the European Commission, of course. Then to end, I think what we can share was, as maybe the examples I gave regarding the implementation board, scientific advisory board, and so on, or participating within the Answer network. I think what we would like to know is further collaboration with projects in the same countries. As we want to implement our new screening device, as we want to see how we can include it in policy guidelines later on. I think it's important to know what other researchers and steps are taking in the country. If there are, if somebody has examples of research translation into policy, that would be very welcome as well. And of course, any network opportunity to disseminate results would be wonderful. Thank you.
Thank you to you. Are there some questions?
I have a lot and a lot of comments, but first I wanted to thank all the speakers today, because I've been in touch with all of you and I really appreciated you presenting, and I found it really, really inspiring, and I have lots of ideas. But I forgot at the beginning, apologies, to also acknowledge the presence of Claudia Robles from the RISC project. So I don't know, Claudia, if you want to say a few words. Apologies, I didn't introduce you first.
No problem. Thanks again for the invitation. I already saw this meet and greet before, and you might remember that I told you we are also a European funded project. So it was nice when you remember us again to be invited. I presented some slides, but I think that we are run out of time. So I will just do a brief summary of our project, if that's okay with you. So we are also an Horizon 2020 funded project, but from an earlier call. So we are not so focused on implementation, but on an earlier stage, we are developing a risk-based screening cervical cancer program. So I've identified that many of your projects are on cervical cancer. So I think that there are many synergies on that. In that sense, for example, I identified that Sonia is doing some work in Latin America. We have this e-oncology platform that is for training, and that it has many materials on cancer that it could be used for Latin America, because most of it is in Spanish, because we have developed them here in the Catalan Institute of Oncology. So most of our work is in Spanish. And the idea is that we are creating these courses on English as part of the project, so that for formation or training of healthcare professionals, I think that's one of our strengths of our project. Another strength is the research. I think we're a consortium of highly acknowledged experts on cervical cancer. So it's also one of our expertise in which we can participate. And as that, I was thinking, you were saying before, I don't remember exactly who, these webinars that could be done. I was actually thinking on these satellite sessions. We have been doing several of them in this IPV or Eurogene that are more focused on cervical cancer. And they have been always focused on our projects. But I think that actually a broader approach with other projects would even be nicer. And since we are many working on cervical cancer, that would be great. And another thing is that this is our third consortium project funded. And in this one, we have incorporated ESGO, the European Society of Gynecology and Oncology, so that it covers healthcare professionals, which is one of the main audiences, stakeholders to be targeted also in communication, and also cancer patients, because in this ESGO, they have engaged, which is an umbrella of cancer patients organizations. And the idea is that we are going to do also some communication to the general population, directly or via the healthcare professionals. Initially, we were thinking on doing, obviously, if our project is risk-based screening, is to promote this kind of approach. However, we just realized recently that it makes no sense. Well, no sense, but to promote cervical cancer screening using a risk-based approach when you have countries in which there is still cytology yearly instead of HPV testing. There are other countries in which it's moving to self-sampling, and in this, Chile is also looking for a self-sampling thing. So we're going to change now the message to be given to this population, moving now towards HPV better than cytology, and also increasing the use of self-sampling. And yeah, I think that's pretty much what I was planning to say in this presentation. And again, thanks for the opportunity to be here. I identified many things that can be helpful. You have communication experts, which I'm not good at because we are research institutions. I think it's obvious that our social media, it's not plenty of followers. You have at CBIG, you have yourself that you're doing many things with stakeholders, policymakers, which is one of the things in which researchers we fail. So I think these meetings that you have arranged, it's a really good idea.
Thanks a lot, Claudia, and apologies again for not having introduced you first. And please feel free to send your slides my way. I will share it with everybody who is attending. And maybe I want to wrap up some things that I've heard as well. So I guess the first easy step for everybody is really to follow each other on our social media, check out each other's website. I created a small Excel sheet which includes all the contacts, as well as the social media handles and the links to the website, as well as our Codis pages. So I will share that again. And the first time it was checked, I think, by the people who attended the first meeting. So I would like to ask you again, you on the call today, to please have a look at the Excel later on and add anything that I might have missed. I think I managed to find all of your social media handles, and I know some of you have the newsletters. So I think that's an easy step that we can take amongst communication work packages to really follow each other on social media. A couple of things I noted down from the EquityCancer-LA project are that they did mention the GACD. So we are funded under the GACD call, but GACD is also an entity on its own, and it's as a more, let's say, global outreach. But a lot of the projects that are present today are also can make use, let's say, of the services and cluster meetings organized by the GACD. So I can send more information about that as well. We at CBIG-SCREEN, we've been involved also in their annual consortium meetings and their cluster meetings. So I think that's something that maybe other projects might not be aware of. I will share that with you in case you're interested. And of course, we note down EquityCancer-LA's wide experience in organizing workshops and meetings, which is something that also EUTOPIA-EAST has. So for the other projects, just to know, especially for Helene, who is joining us today from Mexico, so she joined a little bit later. She might have missed that. And from PRESCRIP-TEC, I've noted down, of course, the great, strong brand identity and communication toolkits and fact sheets they've got on their website, as well as they provide template messages. So I will put links to all of the resources mentioned by Oscar. I think we have a lot to learn from them as a communication agency. And we're really glad to hear that the application for the Horizon Results Booster was approved. So indeed, it's CBIG-SCREEN and PRESCRIP-TEC who have applied for the opportunity. I don't know, Oscar, whether there's a possibility for other projects to join us at this point?
Yeah, sure, there is the possibility. Everyone can join at this stage.
Great, so I will send more info about that, and if Chile, EUTOPIA-EAST, and RISC or any other project wants to join us, please let us know. Of course, PRESCRIP-TEC will be leading on the application and stuff, but it's something that I think, together we're stronger indeed. And from the EUTOPIA-EAST side, of course, I noted down again from the first meeting that we are both working in Romania. So in terms of the organization of this end of project workshops, we should definitely liaise with each other and we can make it together perhaps, especially, I know you guys are focusing on the 3 programs and we're focusing also on cervical cancer specifically, but I think there's synergies there. From the CANCERLESS, it was mentioned possibility of having guest articles, post-opposition papers on vulnerable groups. And actually, I think Chile also focused on hard to reach vulnerable populations. So perhaps they could also be involved in that. And in terms of the roundtables, and here maybe I don't want to put Vanessa on the spot, but indeed we have an event coming up as a roundtable in September. Perhaps not for the September one, if that's already being ongoing the work, and maybe Vanessa has more information, but in future roundtables of the European Parliament, I definitely think that it will be more interesting to take this angle perhaps of a cervical cancer elimination movement and have a few of our projects working on cervical cancer as an overall theme. So not to have just standalone roundtables for the CBIG-SCREEN, but to involve other people involved in the cervical cancer elimination movement. So maybe perhaps not for the September ones, if it's already been ongoing, but we do have indeed 3 as part of our project. So in terms of something concrete, a concrete event on which we can collaborate, I could offer the opportunity to see whether we can liaise with Vanessa and CBIG-SCREEN and organize a bigger meeting.
Yeah, I think, sorry to jump in, Gina, I have my camera off because my internet is rubbish, but I think that sounds great. Like you say, September is kind of already in motion, but after that, like it's a really good opportunity. And again, the whole strength in numbers thing. So, really, really happy to go down that route. Thanks.
Thanks, Vanessa. I don't know, Mark, whether I missed anything. We've been mapping, of course, as part of the CB-SCREEN, a lot of the overlaps, let's say, that we have with other projects. So as part of a follow-up from today's meeting, I can also try and kind of put together and highlight who is working with which type of population and in which country, so we can liaise with each other better. Yes, please, Ioannis, you have a raised hand.
Yes, thank you, Ginevra. Just to share quickly also, minding the time, 2-3 observations I have. In general, that how nicely impressed I am from all motivation I witnessed today from all projects to become stronger together, as you said it. And this is true, and this gives excitement to me. Also working with you alongside with Hadea and Commission, how we can make the best out of it. Please keep this motivation. And actually, I would like to compare it with the feeling I had in earlier years, that it was not so, let's say, widely spread. I think it is in the right direction in how future policies shaping the landscape and the signal what we have to do. Also, I refer, for instance, to the dissemination to open access journals, right? That everything should be open access. I see this openness widely here in the meeting today, and how you would like to share and collaborate. And it's a great message to take home for myself too. This is something general. And if I go to something more specific, I heard Oscar, yes, about the booster. Please try to make the most out of it. It's a new tool, as I said. Try to explore how more projects, better it is, and how you can benefit from that. And videos, some projects you mentioned about having a promotional video, some not. I would generally encourage it because, at least from my experience, we are called quite often to give good examples of videos of projects. So now maybe it's a good idea to see if you can come up with a joint idea of a promotional video down the pathway, right? I'm just putting an idea here, and it's up to you if you can materialize something like that. And I'm saying that because videos fly via YouTube, via different platforms quite easily. You can insert subtitles, reaching the different audiences with different languages and the different people that you would like to reach. It's something that comes often, I repeat. And maybe why not? I would like to transfer my experience, that it's again very draft, it's just an idea, but I would like you to hear it. When we were developing the cancer mission, that Euronews has dedicated episodes for science-driven topics like futurists. I don't know how you do it at national level and how you're, because for me, the matters of vulnerable populations and the inequalities that you touch here, it is really a must also for the general public. And if you can approach even more broader, general, mainstream news channels in each of the country or at the EU level with the Euronews, it might be a good idea to be explored down the way. I think like that, and again, the position papers that Mark and Bea discussed, very interesting. Yeah, if you can come up with a position paper and all the meetings that you have with the Parliament and the Commission, if Mark wonders, I understand, it's a kind of complex mechanism how you approach policymakers. It's also the member states, the policymakers of Brussels, they're in direct contact with the member states that you are coming directly also. It's a kind of I think the more people you can approach and expose your ideas and the joint value of yours, the better it will be. So that's my intervention, and thank you again very much for this productive meeting.
Thanks to you, Ioannis. I don't know if you have further comments to make. You know, one thing that is of interest is that this meeting come at a time where we have a service in France who is in charge of advising on everything that is about health and social affairs, and they just published a report on the organized cancer screening in France, and saying that they do not work well at all. And one of the reasons is that there are too many people involved and bad communication between the too many heads and not enough hands. So that's why I grab up the idea of having some kind of position paper on trying to communicate on how to interact with the policymakers, because really I think that it's hard to reach the vulnerable groups, but it's also hard to take the attention from the policymakers. And I think, I don't know, I think it's Beatrice who asked about research turning into health policy, and that is really one of the major topic.
Good. I'm just going to put up a few last slide on the next steps that we agreed with Mark and here the big screen. So of course, as I mentioned, we'll be sharing the recording and the slides from today. And Claudia, please feel free to send me any slides from the risk project or any information that you would like me to ask in the follow-up. I will ask you to have a look at this small spreadsheet where I've included contact details of all the projects that we've got. And if any of you from the comms spot any information missing from the communication side of things, please do add it. And I think, of course, as usual, we hope that today is just the start of us liaising with each other. Now we've got our contact details, and to really explore some sort of joint activities, let it be a webinar, let it be a roundtable, let it be a guest post. And our commitment from our side is that we'll keep organizing some sort of meet and greets throughout the duration of all our projects. So perhaps the third one will be at some point in the autumn, and we're in conversation with Hadaya and Yanis as well on what kind of focus we can have each time. So as I mentioned, the first time it was just first introduction. This time we're focusing on the communication. Perhaps by the autumn we could start focusing on some sort of preliminary results, or more how we can actually link our upcoming results into policy. So this is the commitment from our side. Anything else I missed, Mark, Vanessa?
No, I think that pretty much covers it. Thanks, Gina.
Good.
I fully agree. I think that you are saying that you will explore the organization. I think that really we need to make one, and we need to keep interacting with the EU-funded projects.
Great, and I think we're actually managing to finish in just on time. So on behalf of the CBIG-SCREEN project, we're really happy to have all of you here today. Thanks a lot for making the time to make presentations. I know you're all very busy, and I will be in touch in the coming week with more information of the slides, the recording, and please do feel free to get in touch with Vanessa from our side, who coordinates our communication, if anything has sparked your interest. And we hope to see you at some point soon, and to collaborate on some of the ideas that we started mentioning today. Thanks a lot.
Thanks very much to you, Ginevra, and thanks
Thank
to
you.
David.
Have a nice afternoon, everybody. Thank you.
Thank you.
Thank you very much.
Thanks, everybody. Bye.
Bye.